Good. Okay. Can you see? You can't see, right?
Yeah.
Okay.
Yes.
Okay. Right. So that is your lungs. Trachea. See, if you palpate your back, can you do it right now? Feel on your back of the neck. You come from above downwards, whichever is the prominent spine, that is C6 vertebra. You can feel yourself. Whichever is prominent, the first prominent the bump is your sixth. That is the landmark for counting the vertebrae from back. You should keep this in mind. This is useful for you forever in your life. So prominent back vertebra in the cervical region is your C6. So from there you can count. And the trachea starts from C6 actually. The prominent is C7, I'm sorry, prominent vertebra is C7, cervical 7. The trachea starts just one vertebra above C6. Trachea begins from C6, the prominent is C7. And as trachea comes down, it bifurcates here. What is angular fluis? Anyone? Angular fluis? How will you feel? How will you know that which is yeah, that is a junction between the body and the manubrium sterni. If you feel your chest, the first horizontal ridge that you come across, you can feel on yourself the first horizontal ridge that you come across, that is the angle of fluis and the junction between the body and the manubrium sterni. There are different names. Any other name you know about? Ludwig's angle, angle of fluis, sternal angle. These are different names given. This is a very important landmark when you are talking about any findings that whenever you are examining respiratory system, whenever you have some findings, you can take this natural anatomical landmark as a description of your science. Okay. The very important point about this is the place where the trachea bifurcates. This is a place where the trachea bifurcates, and this is the only place where the two lungs meet each other. Otherwise, lungs don't meet each other. This is the only point. Just behind the angular fluis, both the lungs come and be in touch with each other. Then this also corresponds to your thoracic, fifth thoracic vertebra in the back. So if you remember these, it will be easy for you to understand the disease process when you are examining the system, respiratory system. So I'll repeat, the trachea bifurcates at sternal angle, Ludwig's angle, or angle of Lewis, which corresponds to thoracic fifth vertebra. And this is the place where both lungs meet. The only place, there's a small place, a half an inch place where both lungs meet. And that is also very important in when you are talking about cardiovascular system examination. This is the midpoint of your right atrium. So whenever you are measuring the JVP, jugular venous pressure, pulse, you take this angle of Lewis from the outside and measure the jugular venous. That is another very important landmark in cardiovascular system examination. Right, that these landmarks you should know. And coming to the lungs, these are the clavicles. Okay, the lungs extend just 1 inch above the clavicle. We think that clavicle is the uppermost part. No, the lung extends into the supraclavicular fossa, half inch. That's why sometimes, many times when you are examined, supraclavicular fossa is very important part of you have to auscultate in the respiratory system exams. Sometimes some diseases, especially tuberculosis, which has a special liking towards the upper lobes, you may find everything normal here when you're auscultating. But if you miss to auscultate the supraclavicular area, you may miss the diagnosis. So, because lung extends 1 inch above the clavicle. So, auscultation of supraclavicular area is very important for this very particular reason. And coming back, 12th rib is the last point of the chest. So, this is basically roughly the anatomical position of the respiratory system, you should remember. And then when trachea bifurcates here into bronchi, right and left, and the bronchi again, they bifurcate, trifurcate, like that, it go on dividing several times. So, and as they are dividing, the size, the caliber becomes small. They divide into 5 generations of 35 times they divide from top to the till it reaches the alveoli. They divide 35 times in about 5 to 6 generations sizes, 35 times until last one. Can you see this? Can you see here? Yes, last one is your alveoli. This is your alveoli. Looks like a bunch of grapes. And this each one is called acinus or acini. Alveoli, acini. This is the functional unit of the respiratory system. This is the gas exchange area that we are talking about. So otherwise, even till the 35 generations, it is only a tubes. There are conducting systems. But only when the air comes in contact with the alveoli, it is only then, it's only there that the gas exchange takes place from here. The CO2 goes in and oxygen goes out of the alveoli into the blood. So the capillaries here, there's a very thin membrane here separating the alveolar membrane and the capillary membrane. That is the functional part on which we are all surviving. So we should remember, as I told you, the surface area of gas exchange is a very big one, and a very micro thin area of mucus is spread, which accelerates this the gas exchange mechanism. And surface tension, surfactant, and the elasticity of these tissues is very important. When the air comes, it becomes big. When air is going, it should come, expand, inspiration and expiration. In some diseases, this elasticity is lost, like in COPD. Whenever there is a distortion of these functional unit of respiratory system, it becomes, I'll talk to you about that. So the elasticity is disturbed, destroyed, and patient